Bismillahirrahmanirrahim. This is Almas Khan, and today I am going to teach you about anaphylaxis. First of all, I will start from the definition. Anaphylaxis is an acute life-threatening systemic reaction caused by an IgE-mediated hypersensitivity reaction, and it is characterized by urticaria, angioedema, acute airway obstruction, and circulatory collapse. Now, what are the causes of anaphylaxis? The most common cause of anaphylaxis is drugs, which may include nonsteroidal anti-inflammatory drugs, beta-lactam antibiotic and non-beta-lactam antibiotics, radio contrast media, proton pump inhibitors, neuromuscular blocking agents, hypnotics, and other causes may include bee stings, food, and food like peanuts, shellfish, and milk, latex products like gloves, and exercise. Now, what are the clinical features of anaphylaxis? In skin, it causes urticaria, angioedema, flushing, and itching. In respiratory system, it causes nasal congestion, sneezing, rhinorrhea, dyspnea, stridor, bronchospasm, and hypoxia. In cardiovascular system, it causes dizziness, syncope, hypotension, arrhythmia, palpitations, and substernal pain. Anxiety it causes nausea, vomiting, diarrhea, dysphagia, and abdominal cramps. In CNS it causes headaches and seizures. In genitourinary system it causes urgency. Now what are the complications of anaphylaxis? The most common complications of anaphylaxis is anaphylactic shock, brain damage, kidney failure, cardiogenic shock, arrhythmia, heart attacks, and death. Now, how we can manage anaphylaxis? So, first line approach is to administer of adrenaline, antihistamines for circulatory collapse and hypotension. We should replace fluid therapy and vasopressor. Other options may include bronchodilators such as beta agonists like salbutamol and corticosteroids and oxygen inhalation. It was for today and hope you will enjoy a lot. If you like my lecture, so please support me and subscribe my YouTube channel for more lectures and medical videos. Thank you so much. God bless you.